Hi, I'm Lesiuk, and I'm going to be demonstrating the subcutaneous injection today. So first, to get started, we got February 7th, 2021. Time is 08:25, and it's time to administer medication. So first, we're going to compare the physician's orders and the MAR. So we got right patient, nursing Jake, date of birth, January 1st, 1960, January 1st, 1960. Patient has no known allergies, and all orders are double signed and transcribed properly. So first drug here, we have metoclopramide, right dose is 5 milligrams, right route, subcutaneous, right time and frequency, daily, it's given once daily at 0800 hours. It is now 08:25 on the 7th, so that one's good to give. Next we have diamond hydrogenate, right drug, right dose, 150 milligrams, right route, IM, that's intramuscular, right time and frequency is daily, it's given once daily at 2100 hours, so we are not going to give that one. We're also going to give the metoclopramide for the patient has nausea secondary to chemotherapy. So next I'm going to find my medication. So here I found it. It's metoclopramide HCl, so that's metoclopramide, that matches. This comes in 5 milligrams per ml, so we're going to need 1 ml because we need 5 milligrams. This one is not expired either, and it says on here it's for IM or IV use. Our MAR says we're going to give it subcut, so we have talked to the pharmacy and the doctor, and they have confirmed that we can give it subcutaneously. And we have referred to our parenteral drug monograph as well, so metoclopramide, and it says here that we can give it subcutaneously, so that's appropriate, and we've reviewed other names and the classification, potential hazards. So next I'm going to review some indications for this drug. So we're using this drug for its antiemetic effects, as our patient suffers from nausea and vomiting due to chemotherapy. Metoclopramide works by blocking dopamine and serotonin receptors in the chemo trigger zone in the central nervous system. Safe dosage for this is 10 to 20 milligrams every 4 to 6 hours with a max daily dose of 120 milligrams. Some common adverse side effects include drowsiness, restlessness, anxiety, dry mouth, constipation. Contraindications for this medication include GI, hemorrhage, obstruction, perforations, or Parkinson's disease. Drug interactions include additive central nervous system depression when used with other central nervous system depressions such as alcohol. Nursing indications include assessing for a history of hypersensitivity, renal impairment, vital signs, ins and outs, daily weight, electrolytes, and blood and glucose. So after I've done that, I'm going to go ahead and find my appropriate syringe and needle. So here we have chosen a 27 gauge half-inch needle for the injection, so we know that that will be appropriate for subcutaneous because subcutaneous injection needles are from 25 to 31 gauge and from a half to 5/8 inch length, so this will do. And we'll choose a 3 ml syringe because we'll be drawing up 1 ml, and we'll grab a blunt fill as well, and we have our medication. So now I'll go and do some hand sanitizer. I will open up an alcohol swab package, and I'm going to swab the top of the medication vial for 30 seconds in a circular motion, making sure that that's clean, and then I will allow the medication to dry, allow the alcohol to dry off the top. So now I'm going to take my syringe, wing back the package, being careful not to contaminate the sterile aspects. I'm going to wing back our blunt fill and attach them together. Then I'm going to prime our syringe by pulling back the plunger to 1 ml of air, and I will remove the lid, the protective cap. Because it fell over there, I'll just swab it off once more for 30 seconds to make sure that we have it sterile. Let it dry a bit, and then I will inject, and I'm going to inject our full 1 ml, tip it back, and let the pressure push back the medication into our syringe. Once I'm sure that I have enough in here, I will draw back a little bit excess so that we can knock out the bubbles. I'm going to take that off, and I'm going to recap our syringe using the scoop method and cap it like so, and then I'm going to pull back on the syringe and make sure all the bubbles are out. Now I'm going to open up our injection needle package, winging it back. I'll take off our blunt fill, throw that in the sharps, and attach our injection needle, keeping all sterile aspects sterile. So now that I have that attached, I'm going to prime the needle and make sure that it's at the appropriate dose. I'm going to be doing this over med waste, so our waste will go into the med waste, and I will get that to 1 ml with no bubbles. So there's 1 ml, no bubbles. After I'm done that, I can make a label. So here we have for nursing Jake, drug name is metoclopramide, and I'll add for subcutaneous. Dosage is 5 milligrams, volume is 1 ml. Concentration, it comes in 5 milligrams per 1 ml. And it is the 7th of February, 2021, and it's 0825, and my signature. So once I've done that, I'm going to attach that to the end of our syringe there. And then I'm going to do my second check. So I have the medication, I have my syringe, I have the MAR. And so first off, we have the right patient, nursing Jake, nursing Jake. Here is the right drug, metoclopramide. Here's our metoclopramide. The right dose is 5 milligrams here. It says 5 milligrams per ml, so we have 1 ml here, and I've checked, and it is the right dose, and it is no bubbles in there. Right route, subcutaneous, so this can be used for subcutaneous. We've checked with the pharmacy. This is our subcutaneous injection needle, so that's appropriate as well. And the right time and frequency is given once daily at 0800. It is now 0825, so that is good to give. So now I can put this back in our med room or in the disposal bin. My blunt fill is in the sharps container. All our garbage will be thrown out, and I'm going to collect my supplies. So I need that, and I need an alcohol. So we'll say this alcohol swab isn't open. We'll say like that. I got my gloves. I need a cotton ball. And we have our pen to document over at the room there. So I'm going to do hand sanitizer before entering the room, and then I'm going to do my entry safety check upon entering, making sure the bed's in the lowest position, patients in no immediate distress, the call bells within reach, and side rails are up appropriately. I'll introduce myself with my name and designation. Hi, I'm Alex Lesiuk, student nurse at the University of Manitoba, and I'm here to do your subcutaneous injection for you today. Could I just get your name and birth date, please? So after they verbally verify their name, birth date, I will check their wristband here. So we got nursing Jake, January 1st, 1960, January 1st, 1960. So that's correct. And do you have any allergies? He says he doesn't have any allergies, so that's what I got here too. That matches. So just excuse me while I go to the end of the bed here, and I'm going to do my third check. So after that, now I'm going to compare. We got nursing Jake, right patient, nursing Jake. Right drug is metoclopramide. Right dose is 5 milligrams, so we know it's 5 milligrams per ml. So we have 1 ml here, that's 5 milligrams. Right route is subcutaneous. This is a subcutaneous needle, so that is appropriate for what we're doing. Right time and frequency, it's given once daily at 0800 hours. It's now 0825 on the 7th, so that's good to give. So after that, that's my third check, I'm going to explain the procedure to the patient. So today we're going to be giving you your subcutaneous injection of metoclopramide, which is an antiemetic drug for nausea and vomiting secondary to your chemotherapy treatment. Before giving you this medication, I'm going to be assessing your vital signs. I'm also going to be assessing for any your renal. I'm going to be assessing your renal and liver, hepatic function. I'm going to be assessing your weight, your ins and outs, I'm going to be assessing your blood glucose level, your level of consciousness. Some possible side effects you might experience with this medication are dizziness, you might experience constipation, dry mouth. If you experience any of that that's bothering you, just let me know. Some patient education for this would be to not operate any heavy machinery or vehicles while on this, because it can cause drowsiness. As well, it could become a fall. You could become a fall risk, so be careful when moving around. Also, do not drink alcohol, because that can have additive central nervous system depressant effects with this medication. I will be assessing you, and after we give the medications, I'll go over those nursing implications. So when we're landmarking for this, I've talked to my patient, and we've agreed to give it in the abdominal area. So we'll go 5 centimeters away from the umbilicus, and that is anywhere in the quadrants of the abdomen area, and we'll make sure not to go in any area where there's bruising from any prior injections. So after that, I would make sure my patient's in the right position, raise the bed, expose the abdominal area, and I would do hand sanitizer, and then I'm going to put my gloves on. I'm going to open my alcohol swab, pull that out. I'm going to clean in a circular motion for 30 seconds. So we'll say that's 30 seconds. I'm going to pull back the safety mechanism to move that out of the way, and I will let my patient know that we'll be injecting. I'll also note that he is a bigger patient, so we'll be able to grab 2 inches, and that means we can inject at a 90-degree angle safely. So I'm going to let him know that we're going to be injecting now. I'm going to pinch 2 inches. I'll inject, stabilize, and I'm going to inject the medication at a slow and steady rate. Once the medication is all injected, I'll hold it in for a few seconds, remove my stabilization, pull the needle out, and let go of my grasp there. I will activate the safety, like so, throw this in the sharps container, and then I will apply cotton ball to the area, not massaging the site. So for any blood there, we'll hold that for 30 seconds. After that, I'm going to remove my gloves and do hand hygiene. Then I'm going to explain to the patient what we'll be looking for. So therapeutic effect of this medication, so the solution of his nausea and vomiting because of the chemotherapy. We'll also be assessing for any of the adverse side effects, such as like dizziness, so we'll make sure it doesn't fall. We'll be assessing for any hypersensitivity and any excessive pain in the injection site. If he has any concerns, to just ring the call bell. After that, I would let him know that we'll be back if he rings the call bell. So the call bell's within reach, the bed's in the lowest position, he's comfortable and safe and says he doesn't need anything else. Lower the bed down. I'm going to make sure to document. So we got here, it is 0825 and my initials UMSN2. So that's documented. And then after my exit safety check and everything that entails, patient's safe, we're going to leave the room, and I will document on any hospital specific priorities, such as the nursing IPN or any procedural documents. And that's it.